Hi friends, this is your friend Homeopath Dr. Sujata Naik saying cheers from Mumbai. Hi to all my friends across all over the world. In India it's 7 p.m, in UK it would be 1:30, and for my friends in Europe it would be 2:30 p.m. on a Friday. I'm so grateful that you're all finding time and getting online to be on this show. It's a very, very special day today. We are celebrating International Women's Day, which is scheduled for tomorrow, the 8th of March. On this day, we celebrate women empowerment. We celebrate the resilience, the strong will of the women all over the world. And while we celebrate empowerment, we celebrate the empowered woman, we must also take a moment to understand that empowerment is not just about willpower or resilience. It is also about physical health. It is also about bone health. A woman with strong bones is especially empowered because she is active, she is mobile, and she is independent. And this is what we ought to celebrate today more than anything else. So before we get on to rest of the stuff, all my women friends across the world, a very, very happy International Women's Day to all of you. And may your tribe increase. May our empowered tribe get empowered men in our lives as well. So I'm going to split this session, which is about 55 to 60 minutes from now, into some sections. I don't want to be too preachy or having a huge long lecture. Everything is available online now. So just to brief about, say about 20 minutes where I'll be talking in short about why bone health is so important for women, what lifestyle changes or tips that we may follow for better bone health, to preserve and maintain bone health, what are the common bone and joint issues that plague women and what can be done about it? How can homeopathy help as a line of treatment dealing with these issues which women now are facing globally? It's alarming because the number of women facing bone and joint issue disorders are now on the rise. Almost, according to the latest survey, after a fall in the elderly, especially in women when they suffer a hip or a spine fracture, the longevity goes down drastically. But almost 80% of them are going to die within a year of the injury. And that's really scary. So what can be done to prevent these, to reach the stage where we continue to be active and mobile until our last breath? This is what I'm going to share with you. I would invite a lot of questions, a lot of queries, which I'll be very happy to answer, so that this becomes interactive. This becomes a give and take session where you go back home feeling happy that your query has been answered. I can then also have a feel that yes, this is where everybody is participating. So let's look in brief about why for women bone health is so important. Rather, I would say that bone health, of course, is important for men and women equally, but the focus on bone health in women is more important simply because her bones and her joints are more fragile than a man of her age. Until menopause, the hormone estrogen is like a warrior, like a checkpost, which prevents osteoporosis, that is making the bones brittle or making them weak. It prevents falls, it gives suppleness to the joints, because estrogen is the hormone that helps the absorption of calcium into the bones. Once the estrogen starts dipping, the risk factors for a woman will almost double that of a man of her age, especially when it comes to musculoskeletal issues. Therefore, maintaining the mobility and preserving bone health for a woman is much more important than a man. Also, the joint capsules of a woman are much weaker. Her bones are more fragile, are more loose. The joints are more loose, making her more prone to fractures, falls, stiffness, pain. So these are some of the factors. The other thing we must focus on is what can be done to prevent this from happening. Is there some cutoff? Is there some tipping point where we can actually turn this around or make sure that this doesn't happen in the later years? In fact, the preservation of bone health or maintaining bone health should start in the early 20s and not wait until menopause. A lot of women get the wake-up call when their knees become stiff, when they realize that today, oh, I could get up and my bones were absolutely, my joints were mobile. On the other day, I couldn't bend to pick up the remote from the floor. And why is this happening to me? It comes as a revelation, as a sudden revelation. And sometimes it's too late because the damage is already being done. So the best thing is to start, is to being aware of how you can preserve your bone health and what can be done to prevent falls and to prevent injuries in later age. For as far as lifestyle management is concerned, all of us know that once we cross our 40s, we are advised to take vitamin D supplements, to take our calcium on time, to make sure that our weight is in check, to make sure that we exercise enough, get lots of sunlight, take our magnesium, zinc, all the trace minerals. Most of us know that. It's all out there. Your doctors who you consult, your GPs or your orthopedicians are going to give you this advice. What is very, very important is how much these things help and why don't they help everybody uniformly. Why one woman benefits from vitamin D and calcium and the other doesn't? These are the things that we must look into. While weight is important in every which way. What is important is to keep a healthy weight. It's not necessary that you have to be reed thin. In fact, you'll be surprised to know paradoxically that reed thin women, especially women who have very thin legs, are more prone to osteoporosis and breakage of bones than the ones who appear a little plump. But important thing is to keep your weight within the range. If you were say 50 kilos at the age of 30, then you should not be more than 56 or 57 by the time you reach 45. So a range of say 5 to 6 kilos is permissible. Beyond that will start giving you problems. It's like carrying 2 sacks of weight on your knees all the time. If you're more than 10 kilos overweight, you're carrying those sacks on your knees and your knees are going to give way someday. So keeping your weight in check. Another thing about weight is lifting weights is important because weight training is one of the keys to maintaining bone health in the later years. So you don't have to go to the gym and keep doing weights. You can do it on a day-to-day basis. The simplest thing is to walk into a shopping mall, buy good stuff. This is what you can do tomorrow on the Women's Day. You have the privilege as well. So walk into the shopping mall, fill your bags to your heart's content. Make sure that each bag weighs equally and carry those bags around and shop the whole day with those bags in your hand. And you have done with your weight training for the day. But jokes apart, this is very important because it keeps your joints flexible and it improves your effort tolerance. So regular exercise, regular sunlight, just taking the vitamin D capsule and staying indoors the whole day doesn't help. Living in India, people living in tropical climates have this advantage. They have the sun free of cost all the year round. And why don't we take advantage of that? We use sunscreens, we protect ourselves from the sun, but we are not taking its benefit. Go out in the sun, the absorption of vitamin D is much, much better when UV rays are directly on you rather than taking the vitamin D supplement, which may or may not get absorbed through your bones. So this is important, a healthy diet. As you grow older, the carbohydrate content should go down. Your protein is important because it provides collagen for the bones. You must make sure that you have good servings of fruit and vegetable. Be active all the time. It's not important to run and do your treadmill in the gym for 2 hours and then laze around for 22 hours. Women do this nowadays. They're working, especially the IT professionals are furiously working out at their work, at their desktops, at their laptops. And the increasing screen time is making life sedentary. So you feel that you have done your workout today for an hour, but the rest of the 23 hours, what are you doing? You're just sitting. Wrong posture, wrong habits. These are leading to much more problems in the younger age group of women these days. So these are some of the lifestyle tips in brief, but if there are questions, then I will be very, very happy to answer them about them. The most important thing, now let's come to how homeopathy can help bone and musculoskeletal disorders in women. Homeopathy has a range of remedies what we call as acute remedies, which can help in minor injuries or after accidents or after a fall. There are some medicines which are known as, which are very deep acting and which we use as constitutional remedies. Homeopathy works at different levels. At the third level are the medicines which we can integrate with conventional medicine in advanced pathologies. In brief, if I had to sum it up, I would say that we have a range of remedies like arnica or rustrox and hypericum and ledum and bellispur and symphytum. These are remedies which are given in acute injuries, and they can be given blanket with, it can be practiced by anybody because they always work. They have a strong affinity to the lining of the joints and the connective tissue, and they help regeneration and growth very quickly. They help to reduce the symptoms of pain and stiffness and swelling and ecchymosis. So these can be given by anybody to a patient who has had an acute injury or a fall or a blunt injury. You can keep them in your kit and give them very, very freely. In fact, this should be a part of the first aid kit for every person. Coming to what is known as the crux of homeopathy is the process of individualization. And by individualization, we mean that the homeopathy is a holistic science because it doesn't believe in disease in man, but the man in disease, the man who has a disease with all his constituent issues. So for example, a person who comes with, a woman comes with a knee joint pain, but she also has a migraine. The homeopath is going to make a note of that. He's going to make a note, he or she is going to make, today we'll talk about she. She's going to make a note of all the problems that the woman may be facing, all the ailments, irrespective of whether they are connected with the chief complaint or not. She will take into account her tendencies, her predispositions, her mental state, her hereditary factors, her family history, and all her previous medical history. Compiled, this makes into the constitution of the patient. All homeopathic remedies are absolutely safe, derived from natural sources, and have been what are called as proven on healthy human beings. So human beings are the allegory for the guinea pigs which are being used in conventional medicine, and homeopathy medicines are proved on healthy human beings. When they are given to the healthy human being in minute doses, the patient is the person. He's not a patient, he's a healthy person. The prover is going to exhibit some signs and symptoms which have been noted in a very, very extensive homeopathic materia medica. And those symptoms are matched with the person who comes with similar symptoms for his problem. And if the matching is done, it's like we are matchmakers. So when the matching happens, the remedy is given to the patient for his ailment. So for example, you have a remedy called causticum, which is one of the chief remedies for osteoarthritis. However, causticum can be given for migraine in another patient. It can be given for a stomach issue in the third person, provided the symptoms match. So not one remedy can be used for one ailment in every patient. To make it simpler, you have diclofenac or ibuprofen or an analgesic in allopathy. In homeopathy, you don't have one single painkiller. We don't kill the pain, but we help the patient to deal with it, because homeopathy works with the immune response of the patient for self-healing. So we have several remedies, and as the questions come in, I am going to answer your specific queries, or if you have any personal issues, if it's very, very deep-seated, you can consult us later. But anything which is general and which is also going to benefit the other viewers, please come forward and ask it freely. There is one question I think we already have. Oh yes. There is one patient who's saying, I work out daily and maintain my weight, yet I have problems and I suffer from pain in the joints. That's a very good question. While you may be, as I just mentioned a little while ago, that you may be working out daily, you may be maintaining your weight, but you may be having a sedentary lifestyle. You may be not moving around during the day. You may be just working out for that much time, and the rest of the time you perhaps are sitting. Your posture may be wrong. You may be not active throughout the day. Perhaps you have other issues like maybe insulin resistance or hypothyroidism or obesity. So we need to tackle those. I have to understand what exactly is the issue. But it is possible that you can be doing everything. You have said that you are maintaining your weight, but how much is the weight? We don't know. Some weights are good for some people, while for another person it may be overweight. So you have to fall into the entire a parameter of normal weight. It doesn't have to be the absolute weight, but the BMR as well. So I think you should consult a doctor, consult a homeopath if you can, who is going to look at your problem in detail and prescribe you the constitutional remedy. There is another question on, yes, yes, she is asking me that I suffer from chikungunya. Chikungunya is a viral infection. She suffered from chikungunya 2 or 3 months ago. But she says that she still suffers from joint pain because she's taken the entire treatment. She took antivirals, she took analgesics, but the pain is not going away. That's a good question. Chikungunya is a very prominent viral infection which is plaguing a lot of people. It's like an epidemic in India today. And the post-viral pains or the arthralgia can last for as much as 3 months, 6 months, sometimes a year. And that's probably because of the immune response, the severe immune response that this disease creates, and that it causes severe stiffness and pain in the joints, especially in the musculoskeletal part of the lower limbs. Homeopathy has excellent medicines for this. You need to, of course, give us more details for this, but several remedies like rustox or bryonia, we have remedies like colchicum, we have pulsatilla, and we have causticum which can help you. However, we need to know things more in detail. A little more of your detailed symptoms will help definitely. There is one more person who's asking me, I think, Purva. Yes, she's asking, I've been getting heel pain. What can be done to reduce it? Again, heel pain is, or what is called as in medical terminology, plantar fasciitis, is a very common problem in women between say 35, 40 to 50, 55. And almost 35 to 40% women are going to get this at some point in the life or the other. While the cause, the etiology is not very specific, sometimes because of hormonal issues, a woman can develop something called as a spur in the heel. It's called as a calcaneal spur. That spur can press upon the fascia of the sole and give you that pain. And the pain is typically on first movement. The woman tries, as soon as she gets up from bed and puts her foot down, the pain starts. Homeopathy is to be without, by default, please take homeopathic remedies for this because it will not only shorten the pain, it is generally this problem is self-limiting. However, homeopathy can help reduce the severity of the symptoms and can shorten the ailment span. And remedies like rustox, ruta gravulans, hecla lava, pulsatilla, sepia are excellent for this kind of problem. So please consult your homeopath at the earliest who's going to get you out of this issue. Incidentally, I would like to share a case with all of you at this point, because this was very interesting and paradoxical. I had this patient who approached me saying that she has severe pain in her ankles and knees, and the pain is very bad when she's climbing steps, when she's climbing stairs, or when she's walking. When she walks for a long time, she has the pain. She's a dancer, she's a classical dancer, and she said, but I have no pain when I dance. I have absolutely no pain. In fact, I can dance for 2 hours, 3 hours at a stretch. She's a performer, and she says she has no problem. The only thing, as she says, that even one flight of stairs, I have a lot of difficulty in climbing. I have difficulty getting into a car because my knees hurt so much. Can you give me something for it? And she has been taking analgesics, she took anti-inflammatory. She's on, of course, calcium, vitamin D and all the supplements, magnesium. Now when I took this case, this seemed very paradoxical because dancing is so much of a more vibrant activity. She does a lot of footwork, and she doesn't have pain at that time. So the only explanation I could think of, and I gave her that, I said, perhaps you're using different set of muscles when you dance and different set of muscles when you climb stairs or walk. So when she dances, she's using her calves, her glutes and her spine, which perfectly is in order. And her knees perhaps are suffering from what is called as osteoarthritis, which is a degenerative condition affecting so many women. So many women, once they cross 35, 40, their bones start giving way, the cartilage starts thinning, and because of the friction, the knees start hurting. By then, the osteoarthritis is already about 20 to 30% on its way. And if you don't take steps immediately, then it can go to something called as very severe degenerative osteoarthritis, where a joint replacements would be perhaps the only answer. But what is important is that you take care of it much earlier. So in this case, we took all her symptoms and we compiled them, and she was I think she was around 45, premenopausal of course, but she was around 45 and very active lady, very cheerful earlier, but she had a lot of family responsibilities which were now kind of cowering her down. She was getting a little restless, getting irritable because there was so much of responsibility. Family, children are now growing up, in college, some financial difficulties. And based on everything, on her mindset, her emotional space, and her chief complaint, her modalities, and of course her family history. There was a history of osteoarthritis in her family as well. Her mother had a knee replacement at the age of 55. So based on that, we gave her a remedy called as sepia. Sepia in 30 potency was given to her about twice a day for a week. And you have to actually believe this, that the patient was almost free from pain. She started looking more active. She started complaining less. She seemed more cheerful when she came on her first follow-up. And we've been following up for about 5 to 6 months. She needed some remedies for acute issues. But overall, the improvement for almost 70 to 80% from what she started off in just about 3 months. So this is what homeopathy can do, because it deals with the human being and not just about the part. So there's some more questions. Okay. Yes, there is Hema Oak who's asking me, what is the deficiency that causes leg cramps at night? Okay, it's generally calcium and magnesium, Hema. A lot of women complain of leg cramps. This is generally post-delivery during pregnancy towards menopause. These cramps can come, and if you are inactive, especially if you are leading a very sedentary life, you are not active, you can develop these cramps. Or if you're overactive, women who are not replenishing their fluids or are getting dehydrated, not having enough minerals in their diet, or not having enough fluids or not having enough water, can also develop these cramps. So make sure that you're well hydrated, you're having your minerals, you're having your vitamins on time. Even if that doesn't help, then please see your doctor, you see a homeopath who will help you. We have several remedies for this. Magnesium phosphoricum is one of them. Zincum metallicum is a very, very good remedy which helps for leg cramps, for restless legs at night. So many women complain of restless legs, when they say that I don't have pain but I just can't sleep because my legs feel, they just keep moving, and I have to keep moving, I have to walk to feel better. If I lie down, it gets worse. And there are remedies like Zincum metallicum, again sepia, graphitis is there. You have remedies like pulsatilla which also helped in these conditions. There is another question. What are the best foods for strong bones? Okay, this is a very good question. While a very healthy, balanced diet is important, if you're a non-vegetarian, that is if you have meat, animal meat, then fish is one of the very, very good sources of omega-3. It's a good source of calcium. So fish is highly recommended, especially salmon is a fish which, salmon and mackerel are very, very good because they are oily fish and they help in bones. Dairy products are again very, very good source of calcium. So milk, yogurt, then cottage cheese, these are good source of calcium. Even cheese is good, but try to avoid the processed one. Have nuts in your, nuts and seeds are again good source of calcium. So walnuts, almonds, about 4 or 5 almonds and a couple of walnuts every day will help you. Certain dried fruits also help because they help in the absorption of calcium into your bones. So these are the foods. So morning routine I would suggest is that every morning, if you have a couple of glasses of warm water and a spoon of flax seeds. Flax seeds are excellent source of omega-3. They help your joints get lubricated. There's another seed which is very useful, which in India is used very extensively, and that is sesame. Sesame is one of the very, very good sources of omega-3. It has essential oils which can lubricate your joints, and it has calcium. So in the months of, but because it is, they say, heat producing, it can cause boils and skin conditions in very, very hot or tropical environments. Try to have them when the when it's a little cold or in winter months, and they can be really useful to preserve your joints. Because in winter, the joint pains are much worse for women, especially degenerative arthritis. So this is the kind of thing you should do. Go for a walk no matter what. Walking is the best form of exercise to preserve your bones. And you don't have to overdo it. You don't have to run. You don't have to be a marathon runner. If you are, it is excellent. But if you aren't, then do walk as much as you can. Walk for 20 minutes in the morning if you don't have time. Walk for another 10 minutes at lunchtime. Walk at sunset. So split your walk into 3 times a day. Even if it's short spans, you don't have to overdo it. People who walk or run for 10 kilometers and then for a day and then don't walk at all for the rest of the week are prone to more injuries than people who have moderate exercise, say 15 or 20 minutes every day. So some amount of exercise is important every day, no matter what. Just get up and get out. This would be the key. A small breakfast, don't skip breakfast. A small breakfast with, as I said, with nuts, something with dairy. If you are a vegetarian, dairy becomes very important. If you're a vegan, then your challenges are much more, because then you need to concentrate on nuts, seeds, on all green leafy vegetables, on kale, spinach, fenugreek, lettuce. These should be an important part of your diet compulsorily. Whole grains are a good source of calcium again. Millets are now the in thing, and millets do have good amount of calcium. There is something called as fenugreek seeds, methi as we call it in India, and they are very good lubricants for the joints. So if you can, they are a little bitter, so if you can, it's okay. If you can't, then try and incorporate it into your daily cooking. So if you can soak a spoonful of fenugreek seeds at night and chew them and drink the water in the morning, it's supposed to be an excellent way to lubricate your joints. Yes, Madhura is asking me, what can women in their 30s do to prevent osteoporosis in their older age? That's a very good question. As I said earlier, is that women should start looking after their bones and joints right from their 20s and not wait until the damage is done or until you achieve menopause, after which sometimes all you can do is to repair the damage, but you can't prevent it. So what you can do, Madhura, is one is that trace back your heredity. See whether your mother, your grandmother, your maternal aunts, your paternal aunts, what has been their bone health. Whether there have been premature falls, whether there have been premature fractures, whether there's been a history of several fractures in the family, whether there have been joint and bone tissue disorders, anybody with inflammatory arthritis like rheumatoid arthritis, or with premature osteoarthritis. These are the things you must first see whether if that is the case, because your genes are something you cannot change, but they can be an indicator how you should take care of your health. If there is a history of good bone health in your family, then you need not worry, you need not panic. You can just follow the usual lifestyle measures. However, if there's a history of osteoarthritis, early degenerative arthritis, it's a wake-up call for you. Make sure that you maintain your weight. As I said earlier, you should not put on more than 4 to 5 kilograms throughout from 30s to your 50s. Maintain your weight, keep it within the range. Maintain a healthy weight. Do not go to the other extreme where you become thin and famished and your bones become thin and are more liable to break. Concentrate on calcium-rich foods. Make sure that you conserve your calories, which will give you enough nutrients and which will take away the junk. This is important. If you're an office worker, if you're sitting at your desk for more than, say, 7 or 8 hours a day, then every 30 to 45 minutes you must take a spin, get up, do a quick, you can do some sit-ups, you can just take a spin around. If you have a skipping rope, do some skips, just take a walk, drink a glass of water and come back to your desk. 30 minutes, 30 seconds is not going to do any harm unless you're in a meeting. If you're working, then every 30 to 45 minutes you should get up, take a sip of water and come back to your bench, because that is going to really help keep the flexibility of your joints. There are some exercises you can do in your sitting posture. You can consult your gym instructor or the person who is looking after your exercise for those, or you can see them online. There are several exercises which you can do sitting. Make sure that your chair, the place where you're sitting for most of your working hours, is ergonomically perfect. The chair, a lot of us have poor posture habits, and this can give rise to a problem with your spine. And spine, wrists and hips are the areas which are most prone to fractures. And these are the things that you must take care of maximum. So yes, there is one more question. Yeah. I'm 6 weeks postpartum. Karishma is asking me, I'm 6 weeks postpartum. Please advise if the traditional belief of malish or massage helps in maintaining bone health. Oh, that's a wonderful question, Karishma. That's really good. In India, I think everywhere, postpartum women generally go for massages to help keep the suppleness of their joints and their bones. It's a good thing, though it doesn't improve bone health, because what it does is it helps your musculoskeletal system to be in order. It helps your joints, your tendons, your muscles and your ligaments to be supple. All the stiffness that has come during the delivery, during the pregnancy, all of that will definitely be helped. However, for your bone health, you have to take calcium supplements during your pregnancy and in the postpartum period, because that is the time perhaps you'll be lactating as well. So the need for calcium goes up. And if the care is not taken at that time, you can probably, get calcium deficient in the later months and years. Interestingly, our bone health doesn't depend on our health alone. It depends on your mother's health during pregnancy and what she had during the birthing stage, birthing phase. So if you want your child to have, especially if you're going to have a daughter, then from the pregnancy you must make sure that you have calcium rich foods, your calcium levels are normal, so that your baby is not born with calcium deficiency or develops calcium deficiency later on. But that's a good question, Karishma. There is another question. Yeah, there's a strong history of bone issues in my family. I'm turning 40 now, so how can I take care of my bone health? This is asked by Himangi. Again, very, very good question, Himangi. I've partially answered this before, just a couple of questions before. Is that if you have a strong history of bone issues in your family and you're turning 40, so you're entering into what is called as the premenopause. That's when your estrogen will go down and your bones will perhaps become weak. So this is the right time to consult a homeopath, because the homeopath is going to trace your problems from your family history, from your mother's, your grandmother's, your aunt's family history. And based on that and your current constitution, and if you have any kind of other predispositions, take everything into account and give you what is known as the individualized, the customized remedy, which will prevent the bone loss or loss of bone density later on in life. Interestingly, just one more thing is that many women undergo lots of investigations. Now in India especially, it's just easy to go into a pathology or an X-ray sentence, I want this done. But what is very important is that as soon as you touch 40 or 45, the most important test that you must undergo is known as the DEXA scan, which measures your bone densitometry. This will show you which part of your body is more liable to osteoporosis or osteopenia, which is reduced bone density. Osteoporosis is weak, brittle bones. And you'll be surprised, because you will never expect that, oh, I don't think, because my forearms look pretty okay. And how is it that you're osteoporotic, and how is it that the fracture risk here is maximum? And so now when you know that this is the case, you have to be careful with your wrists, careful with your forearms. Or if your spine is showing tendency to fractures later on, then you should be careful about your spine. Make sure that you don't do unnatural movements, you don't put undue pressure on that. And take your medicines and consult your homeopath. Yes, Chetna is asking me to get vitamin D, what is the right time to get? Sundays, early morning, or 9 a.m. to 10 a.m. Well, does the sun only shine on Sundays? I'm not sure. But the right way to get vitamin D is every single day. In summers in India, the sun can get pretty hot by the time it's 8 a.m. So the right time, sunrise would be around say 6 a.m. So the right time to go out in the sun would be around 7 to 7:30. When the sun is just up and enough to give you not just a warm but light, but enough UV rays to start manufacturing vitamin D in your body. So that's the right time. In winters, it might be around 9 to 9:30 a.m. Thank you, Chetna, for that. Yes, one more question. Thank you for your response. I'm so glad. This is like talking to each. I feel that I'm in front of you. I can really see myself right now, but I'm imagining that all of you are in front of me. So, yes. Okay, sorry, sun rays. Okay, to get sun rays early in the morning. Chetna corrected. Thank you. So, Priya Tanmay is asking, does hysterectomy patient face bone issues? Do they face more bone issues than others? Yes, Priya, they could, but it depends on when the hysterectomy. Hysterectomy is removal of the uterus, surgical removal of the uterus. So when that was done, if it was a premature hysterectomy, where like in your 30s or early 40s, and whether your ovaries were intact or ovaries were also taken out, depends on that, because ovaries are the ones which produce the hormone called estrogen. However, premature hysterectomy will also stop ovarian function sooner or later and make you prone to osteoporosis. But if it's towards menopause, then except for the little discomfort that you have, you probably won't have more risk than other women having menopause at that age. So it depends on that. But if you've had menopause very early, then that's definitely a red flag for bone health. And you must then consult your gynecologist and consider taking all your supplements on time. Your exercise should be much more than the others around you. And keep your weight in check, very important there. And another thing is, somebody was asking that does everybody need to take calcium after 40? Do all women need to take calcium supplements? Not really, actually, unless you are in a stage where the demand of calcium in your body is higher than the rest, or if you have a condition where calcium depletion is happening, or your calcium is not being absorbed from your body. So as a blanket, you need not take calcium. If you're healthy and if your calcium levels are normal in your blood report and you have no aches or pains and you maintain a healthy weight, then there's really no need to take supplements if you are having a good diet as well. However, towards menopause, once the estrogen starts going down, then the tendency to degenerative arthritis goes up, and reduction in calcium or deficiency of calcium is going to speed it up. So perhaps you could, under your doctor's advice, take calcium supplements as advised, as prescribed, and not just take them off the counter, off the rack, and keep taking them, because excess calcium gets deposited in the extracellular spaces, and if you have a tendency to kidney stones, it can cause kidney stones as well. So just be careful. Excess of vitamins, excess of calcium is not good if it is not needed. So this, I hope, answers your query. Monisha is asking, my uncle had a knee surgery a month ago. He developed an infection in his surgical wound. Can you prescribe something for that? Well, we of course need more details, but homeopathy can definitely help. I'm sure he's had his round of antibiotics, anti-inflammatory, and the surgeon is monitoring him. We have very good medicines for this condition, which mostly is called osteomyelitis, that is an infection of the bone. And remedies like bacteria, crore, mercuris solubilis. You can have remedies like hydrastis sometimes, which helps ulcers and wounds. And Cilicia, which is a very good remedy. Calcarea floricum is a very good remedy for this. However, it's not right to prescribe anything just offhand unless I have more details of this. But feel free to share his case with me and I'll see if I can help you there. Yes, Meena Pednekar is asking me, recently I heard a video on YouTube that sunlight should be taken from 11 a.m. to 4 p.m. in the morning. So 11 a.m. in the morning to 4 p.m. Well, 11 a.m. is the time, Meena, is that the sun rays are almost at their peak. So, you can have direct sun rays. Now, the thing is that it's like choosing between two evils, So, on one hand, you get enough sun to make vitamin D. On the other hand, so much of sun, direct sun on you, can give you sunburn, can give you other issues also, can give you migraines, headaches. It can also sometimes, if you keep taking it daily at 11 a.m., you may even be prone to skin cancers. So just be careful. Just enough sun is maybe about a half an hour of sun exposure at an appropriate time would be better than sitting under the hot sun at that time. Asha is asking me, my mother and my aunt both suffered hip fractures in their 70s and never recovered. I'm 56 now. What can I do to prevent this from happening with me? Yes, that's a good question again. And if you remember earlier in an answer to another question similar to this, I had said that if you trace your family history and there is a history of hip fractures or history of poor bone health, then that's a red flag, that's an alarm bell which is rung, and you must take steps immediately to see whether you are prone to that. A DEXA scan is an excellent way of evaluating your bone health. And of course the other things, see whether you have any hormonal issues. One main hormonal issue that can make you prone to osteoarthritis or to calcium deficiency is hypothyroidism. Thyroid disorders are on the rise for several reasons. Again, sedentary lifestyles, obesity, wrong eating habits. PCOS is a condition which also happens with women because of lifestyle faulty lifestyle. And then this can predispose you to degenerative arthritis, to aches and pains, to backaches and knee issues. So if your mother and grandmother and your aunt have had this issue earlier, hip fractures, make sure that you see your doctor. He will advise you, she will advise you to do an DEXA scan. See a homeopath, as I said, because homeopathy is a very, very unique system of therapeutics which not just treats your problem, but it treats your predispositions. It doesn't kill your pain, but helps you to deal with it. Pain is a symptom, pain is not an ailment. So suppressing the pain doesn't help. If you have to take an analgesic for more than a week, you need to address why the pain is there and deal with that. Okay. Yes, Asha, I have to tell you again in continuation of your question, is that falls in the elderly are something which you really need to watch out for. We all have to, in fact, we have to learn how not to fall. This should be one of the major trainings. And everybody who has any kinds of aches and pains, this is one more suggestion that I would like to give you, is that always consult a good physical therapist. A physiotherapist will give you the proper exercises rather than watching on YouTube and the do-it-yourself. Please consult proper professionals who will help you, who will guide you with which kind of exercises are good for you, which kind of movements are good for you, what you should do against effort, what you should do with your effort is something they will advise you. So employing a good or consulting a good physical therapist is a very good investment. So take care of that. I think there are a couple of more questions. Yeah, there is some that somebody asked me just now, is that how do you prevent bone cancers? Now, cancer is something which doesn't show up unless it happens. But again, as I said, that if there's a history of cancer in the family, any kind of cancers, so in women especially, breast cancer, cervical cancer, these are things, ovarian cancer, these are again red flags. So you should watch out for any symptoms related to those, any kind of postmenopausal bleeding, or if you have any kind of a lump anywhere, or you have bloating which is unnatural, if you have any digestion issues. Again, I have to tell you that certain issues like irritable bowel syndrome or ulcerative colitis or Crohn's disease or autoimmune disorders like cystic fibrosis can affect the absorption of calcium from the gut, and that can give rise to osteoporosis as well. So if you have any allied issues which need to be tackled, please tackle those and not just go on taking calcium, because calcium deficiency is never absolute. It is always secondary to something. So address the main problem first, and then the result will take care of itself. So regarding cancer, patients who are on chemotherapy or on cancer therapy may need calcium supplements, because most of them, especially all the immunotherapy, or if they are taking hormonal replacements, they need to take extra calcium because there's going to be depletion of calcium from their bones. They need to take extra care of their nutrition so that the calcium, magnesium, all the trace minerals are taken care of. The bone and joint issues are also handled well. So this is very important. There is one more question, I think. Yes, this is very important. I recently suffered from frozen shoulder and my doctor said it is because of diabetes. How can homeopathy help? Oh yes, how could I have missed this? Diabetes and pre-diabetes, as they say. This is a new term today. Pre-diabetes is when your average, that is the HbA1c, the average blood sugar calculated over the last 3 months is higher than 6 or 6.2. and they say that you're in pre-diabetic range, which means that you have insulin resistance, and then you're prone to diabetes. So these are one of the main factors for having aches and pains in the joints, especially a frozen shoulder. You will first rule out diabetes, whether if the patient is between say 40 and 60 or 40 and 70, and the patient comes with a frozen shoulder, oh, I can't move my shoulder, I can't take it behind, especially lateral flexion is very painful, then you will first rule out diabetes or pre-diabetes. And what happens in this is called adhesive capsulitis. The capsule around your shoulder joint becomes thick and stiff, with the result that there is pain and on any kind of movement, especially when it is done against resistance. Homeopathy has excellent remedies. We have bryonia, rustox, ruta, calcarea, carbonicum, pulsatilla, so many of them for frozen shoulders. You have to see your doctor, and of course you have to do physical therapy, physiotherapy, get it ruled out, get your x-rays and scans as your doctor advises, and take homeopathy along with it. What can be done about non-healing fractures is one more question somebody has asked. Again, why is a fracture not healing? For several reasons. It could be because of low immunity, the patient may be having other comorbidities, or a patient who's been on steroid therapy for a long time, having for some autoimmune disorder, or is on certain immunosuppressive therapies. There, this can happen, that the fracture just doesn't heal. Again, homeopathy can, if it is integrated with the conventional therapy, with the physical therapy, with bone strengthening, most of the time biphosphonates are prescribed by doctors to strengthen the bones. Homeopathy can definitely help reduce the symptoms regarding the pain, can help the fracture heal faster, and works beautifully with conventional medicine to give much faster results. Here I'd like to share one more case. It just came to my mind just now, and this case is about around a 28-year-old girl, I remember, and she was a case of allergic bronchitis since childhood, suffering from recurrent coughs, colds, wheezing attacks, used to take nebulizers and inhale steroids for a long time. Recently, like she is working in an IT firm, and recently she had 2 or 3 episodes where she had very severe wheezing attacks, and along with the inhaled steroid, she was also given oral steroid, that is tablets. And steroids, as you know, are life-saving, but they can have severe detrimental effect on your bones. With the result that her bones became weak, she started having pains and aches, she put on weight, but her asthma was very bad, and she needed to keep taking those medicines. So here when she approached us, now what homeopathy, as I said, because it deals with the human being as a whole, we needed to get both her problems out of the way. Her aches and pains, her bone issues, and her asthma. So when we took her entire history, there was a strong emotional quotient over here. She had joined a new company very recently, and she was not getting along with her boss. For some reason, the boss had an angst against her. There was something that she did that rubbed him the wrong way, and he would insult her in front of others. He would demean her, and she used to feel extremely humiliated, because she was a very ambitious girl, go-getter, a very productive girl, very always action-oriented, with very good academic record. And she felt extremely humiliated, and that's when her episodes of asthma went up, and then the subsequent effect on her bones. So there's a remedy in homeopathy called lycopodium, and when we give her lycopodium in 30C for about a few days, her condition improved remarkably. Her episodes of bronchitis came down. Of course, we had to also intervene with certain acute remedies as and when her symptoms presented. But lycopodium was a constitutional remedy, and that was given at the outset for a few days, followed by the acute ones. And her bronchitis improved remarkably, and because her bronchitis episodes came down, her asthma attacks came down, her wheezing came down, though she started developing what is called as a severe running nose after that, and she developed an episode of urticaria, one episode of severe urticaria. Urticaria is hives, those eruptions which you get, the allergy on your skin, which she had got many years ago as a child, and which had disappeared, and it came back now. So this is an absolutely good signal for a homeopath, because that means that a disease is now being externalized, and we did not suppress it. We told her, and she was amenable to our suggestion that please do not take anything which suppresses the itching. Just hold on for a day. It subsided on its own. So did her bronchitis attacks, and because her bronchitis came down, her need for steroids also came down, and gradually she healed. She took about 6 to 9 months to heal completely. But we are very glad that we could approach this in this holistic manner. So such cases respond very well to homeopathy. Of course, in acute attacks, you need to take your nebulizers, you need to take your inhalers. But homeopathy is the system that works beautifully with conventional medicine. There is somebody asking me. We have time for a couple of questions more. Sangeeta Jain is asking me, I'm suffering from C4 and C5 and C6 and C7 nerve compression. The doctor suggested surgery, but is there any remedy for the same in homeopathy? Thank you, Sangeeta. I understand that you must be really suffering from pain and lack of mobility, because your entire cervical spine must be stiff because of the nerve compression. Well, since the nerves are already compressed and the doctor has already suggested surgery, let me tell you is that homeopathy doesn't come in as a substitute for surgery. No, homeopathy is like medical management. So when medical management ends or stops, that's when surgery comes in. However, I would still say that you consult a homeopath ASAP and see whether you can get relief from the pain. And until you decide to go in for the surgery, if you can buy some time and take homeopathy and see whether it really helps you. Because along with other conventional measures like physiotherapy and lifestyle measures and taking care of if you have any kind of emotional issues like anxiety or nervousness or any kind of depression, then those can be handled as well with homeopathy, and perhaps your problem can be sorted. But definitely at the outset, I cannot promise you that homeopathy is a substitute for the surgery. Yes, so this is one more question. Is there another question? I'm just seeing. Yeah, one last question I will take is that how does what can be done in hypothyroid patients, and how is it that thyroid affects bone health? Yes, very good question. As I did mention earlier that hypothyroidism is one of the key problems that predispose a patient to reduced bone health or reduced bone density, because the thyroid is like the CPU, the central processing unit. It's the main organ, the main gland which controls the endocrine system in your body. So on your thyroid gland depends on your ovarian health, your reproductive health, your joints, your muscles, your tissues, your digestion, your health, your mind, and everything. So if the thyroid is sluggish, it is underactive, it is lazy, so it produces less hormones. So you have a typical case of hypothyroidism where the first step is when the TSH goes up. So the TSH is not a thyroid hormone, it is a pituitary hormone. But what it does, it is giving the signal to the thyroid, become active. And if you're not active, then the T3, T4, which are the main thyroid hormones, also start showing change. They start going up. So they start going down, which means that the TSH is going up. So which means that the thyroid is getting suppressed. And therefore, it is actually reducing the calcium absorption. It is affecting your reproductive system and your musculoskeletal system. So your bones start becoming weak, you get tired, you feel lazy all throughout the day, you don't want to work, menstrual cycles can get altered, you can put on weight. So these are the problems that are associated with hypothyroidism. One is with the bone health, and two is because of all the peripheral factors that go with hypothyroidism, reducing your mobility, reducing your activity, making you more prone to bone and health diseases, joint and connective tissue disorders. So make sure that if you have a thyroid disorder, get that sorted ASAP. Make sure that you are more active, because hypothyroidism predisposes you to more laziness, indolence and inactivity. And if you're inactive and indolent, you get more prone to hypothyroidism. So it works both ways. So if you start becoming active, develop some kind of a sport, or you go out more often, go out in the sun, do some running, skipping, reduce your weight by even 2 to 3 kilos, you'll find that your thyroid levels start coming back to normal. And of course, in return, you are getting back your bone health. So this is something about bone health. There is one more question I think about, yes, about smoking, how tobacco, in fact, smoking and excess alcohol consumption are absolute no-nos if you want to preserve your bone health. Tobacco is an absolute no. Apart from the fact that you look at, when you're talking about equality in men and women, this is something that definitely need not be equal, because tobacco in any form is going to reduce your bone health. Alcohol in moderation, especially red wine, as they say, because the resveratrol will help you. However, you don't have to have it to maintain or preserve your bone health. But excess alcohol consumption is definitely is a red flag for bone health. Homeopathy can help here. It can not just reduce addictions, but it can actually help preserve your bone health if you're an addict, or if you have a problem with tobacco, or because your bones are being damaged due to these addictions. It can definitely help, because it may not restore the bone health. There's no medicine which can restore bone health just like that. But it can actually help you deal with your addiction, because why the person who has an addiction has gone into it, there has to be some predisposing factor, and we will get to the root of that, and perhaps getting to the root of that will then help you understand that once you realize that this needs to be curbed, perhaps it will help your bone health in the long run. So yes, wonderful connecting with all of you. Any more questions? Let me see if I missed. Oh yes, I think Neeta Rao asked me a similar question. Can homeopathy help in curing addiction? Oh yes. Again, this is it's a very broad question. But homeopathy can definitely help, because it, as I said, it deals with the patient at every level. And rather than giving something which will give you kind of a distaste for alcohol or produce nausea when you have a drink or a smoke, that's not how it works. It will, if the addiction has been because of some kind of an emotional weakness, or at some stage in your life where you have given into these addictions because you were not mentally capable of handling your situation, that's where homeopathy can come in, deal with that, help you deal with it, and perhaps help you to reduce the addiction. Of course, there are several things that you need to do to get rid of an addiction which is very, very advanced. But homeopathy, in whatever way, it is going to help you. There is another question. I am a 48-year-old woman and I suffer from fibromyalgia. Do you have any treatment for this? I'll quickly wind up this session with this last question. Now, fibromyalgia is a musculoskeletal disorder. It is generally autoimmune, or it could be hereditary. Genetic factors play a key role, where the aches and pains, in joints and muscles come at random points. So you can have a pain in the neck and suddenly it radiates to your head, or it can go to your arm, and it comes with extreme fatigue and loss of energy. Stress, this is one condition where homeopathy can really help in a big way, because the only remedies that are given are anxiolytics or gabapentin. But homeopathy can really help, because it, again, as I said, goes to the root of this. I had this patient who was a case of fibromyalgia, and nothing was helping her. All the strong painkillers, gabapentin, injectable steroid, nothing seemed to help her for very long. She was a very active woman. She was in a business of her own. But when we asked her history, so it went back to the stage when she was an adopted daughter, and she didn't know that. And her foster mother brought her up like her own daughter. And when her foster mother died, her real mother came to meet her, and that's when she said that, and she said very casually, without any emotion, is that, "Oh, I am your real mother. The one who died was your foster mother." And at that time, she felt that she was stabbed in the back. She was stabbed, and her pains always would be described as, "I feel stabbed. The pain is stabbing. It is hitting me." And there was a remedy called as natrum muriaticum, which helped her get out of this. So fibromyalgia is a condition where homeopathy can help, because there are a lot of, it's a psychosomatic condition more often than not. And when painkillers and when immunosuppressants or steroids don't help, and anxiolytics also don't help, sleeping medicines don't help, homeopathy can definitely give you a more well-defined and a more safe therapy. So thank you very much, guys, girls. You've been very, very patient and very interactive. My Women's Day is made. So, but the slogan for International Women's Day this year ought to be strong bones for strong women. Cheers. See you again very soon. Please give me your responses, and if you need me to speak on some other subject which is close to you, please feel free to let me know. Thank you. Bye.